Hello and a warm welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And we are very busy getting ready for our Gold Labor and Delivery Symposium of 2025. And today with me here is Lara Proud. Hi, Lara.
Hi, how are you?
It's wonderful to have you here. You are, of course, part of the symposium. You have a presentation titled The First Latch, Supporting Breastfeeding in the Delivery Room. We'll jump into that in just a moment here, but I want to learn a little bit about you and your background, your professional background.
Sure, yeah, I am a registered nurse. I'm also an IBCLC, and I did my orofacial myofunctional therapy training, um, working on getting into the craniosacral therapy as well because of the massive benefits of it. So I just really love anything around the whole perinatal time when it comes to birth, pregnancy, and lactation and postpartum.
Yes, it's wonderful, and you're so passionate about the topic, right? And so I love the topic that you're bringing up about breastfeeding very first latch in the delivery room, right? And we know birth, it can be, it can be for some people it is very intense. Sometimes birth is not how the parents hoped or had intended it to be, right? And there's maybe unforeseen emergencies or things that can go differently. Birth can be very long, as we know. It's not just a quick event, and afterwards the parent is often exhausted and there's so much going on, right? So tell me about that very first latch. That is, for me, it sounds like a huge opportunity, but also it could be not without challenges.
100%. And I mean, there's so much, especially when we look at a provider's ability to support that first latch and make a difference in the longevity of itself in breastfeeding and somebody's breastfeeding journey, because that first latch where all of the hormonal cascades and things that happen and how absolutely essential and important all of those different pieces are to it, that when you get these little interruptions and things that can happen, little, not to discredit any of the things, because some of them are really big. We've got all kinds of complications that can come up through the birth situation or postpartum, things like that, for both mom and for baby. Um, all of that plays a huge part in the way that baby is able to latch. We've got both physical challenges for the person who is giving birth. We've got physical or, um, you know, even psychological or physiological interventions and things that need to happen, or can happen, that can impact the way that baby is responding to all of this stuff as well. So there's so many different things. And as providers in those scenarios, we do have so much more that we can do than what maybe we think we can. And sometimes it is a matter of, some pretty intense advocacy for policy changes and things along those lines. But other times it's really just a matter of taking that extra minute, as exhausted as you may be, and spending that time educating your patient.
So we know about the bigger disruptions, like for example, a C-section, right? That could obviously have an impact on, the first latch breastfeeding success. But what are some smaller, routines or common practices we might use unintentionally disrupt the first latch?
It can be something as simple as doing baby's weight too early in a period of time that it doesn't need to be done, or doing their measurements, or different things like along those lines. Being exceptionally disruptive with vital signs that obviously need to be done, but do not necessarily have to be done in a way that removes baby skin to skin. Babies have this amazing innate instinctual drive to go through these specific stages that they need in order to create an optimal latching environment for themselves, and allowing that to happen and not disrupting it with sometimes very routine practices or early transfers off of the unit or different things like that. It's not it doesn't have to be complicated, and it doesn't have to be anything other than, like, this is the way we do it, but it can have a massive impact on the way that breastfeeding success can happen, especially if we're interrupting that first golden hour or golden period of time, in the first 2 hours postpartum.
Absolutely. So there's also little things we can do, maybe just step back. I know everybody's busy and we're on schedule with so many things, caring for so many little ones in the unit, but there is definitely benefits to that we can change practice into. And many hospitals have already started doing that. They're not longer rushing or right away or giving some time at least. So I see some great changes already happening, but I think more still can be done. Um, so now tell me about this. So the first latch is happening. Some babies are very eager. They're, little champions right on. Others may be drowsy from depending on what's going on from the birth, what's happened there. How can an IBCLC or clinician or nurse distinguish between what is normal, like what is normal between, just a little bit of a slow to start, but then everything is good. Distinguish that and real true challenges or dysfunctions.
I love that question. I think you really need to look at the factors that have led up in pregnancy and then also in the birth experience itself. Like, was there medications used? What types of medications were used? Was it an induction? Was it, very narcotic heavy delivery? All of these different things that can potentially impact a baby and their ability to kind of get past that first little bit and past the sleepy stage. Babies are not lazy. They're not born to be lazy. They are not meant to be in any way because, I mean, from a biological perspective, that makes no sense for them
Right.
to be able to survive. So,
That's right.
in order to get really the whole picture, you kind of have to look at all of the factors that are involved in the birth and piece together individually what is going on with that baby. Maybe if it was a really complicated delivery and there was some instrumental use going on, like, are they then responding with like a traumatic situation that they have experienced? And how can we then, dig in a little bit deeper? You do a functional assessment on their mouths. Like, do we have any type of dysfunction happening? There's so many different places that you can dive into. Um, but sometimes it's a challenge in and of itself just to be able to get that baby to breastfeed and not jump right to, like, extra supplementation, for example.
Yeah, absolutely. Absolutely. Well, thank you for that. Now, before I let you go, we're very excited about your presentation coming up here at Goals. Any final wise words from your side with regards to the topic and what you hope our viewers will take away from it?
My hope is that anybody who is working in this incredibly vulnerable period with these moms and babies and partners and all of these people who are giving birth, you will have some tools that are not complicated overly, but be able to make truly an astounding amount of impact on people's breastfeeding journeys and ultimately be able to increase breastfeeding success rates, um, which is a huge goal globally and for so many good reasons.
Absolutely. Well, Lara, thank you so very much for being here today. It was such a pleasure speaking with you, and we're looking forward to having you here at the Gold Labor and Delivery Symposium 2025. Thank you so much for being here with me today.
Thank you.
And now some information for our viewers. As I mentioned, Lara's presentation, the first latch supporting breastfeeding in the delivery room, is part of the Labor and Delivery Symposium. We have a live, open access, free keynote presentation planned for the October 6th, and we hope to see everyone there. Please go to Go Learning to find out more information on the keynote, on Lara's presentation, and all the other presentations that are part of the symposium. And we hope to see everyone there. Thank you all for watching and have a lovely rest of your day. Bye bye, everyone.